Hello, everybody. My name is Trias Bianchi, and it's a pleasure to be able to speak with you today. My colleagues and I are here to discuss with you the intricacies of COVID-19 in a long-term care facility. For this webinar, I will be discussing the pathophysiology of COVID-19. Next slide, please. Followed by Anna Carpenter, who will be talking about behavioral considerations and mechanisms of action we can use to ensure health and safety, after which Claudia Jurema will further join us to discuss environmental considerations. Ben Brown will elaborate on the economic factors relating to COVID-19. And finally, we will conclude with Savannah Mahaffey speaking about system-wide effects of COVID-19. Once we have thoroughly discussed our material, you'll see me once more, and there will be an opportunity for questions for our panelists. Next slide, please. All right, now let's talk about the pathophysiology. So most of you are probably already aware of COVID-19. COVID-19 is an infection caused by the SARS-CoV-2 virus. It is an airborne virus that is droplet spread, and it affects an individual's respiratory system. Next slide, please. The most common symptoms include shortness of breath, coughing, sore throat, and fever. Many individuals recover without complications. However, special considerations must be made for the elderly and those with compromised immune systems. Short-term effects of COVID are many of the symptoms already stated previously, but the long-term effects can be loss of smell and increased resting heart rate. Next slide, please. Vaccines help by introducing your body to the distinct spike proteins present on the COVID virus and preparing your body's immune system to fight the real thing. The virus itself is zoonotic, originating from animals. Special considerations need to be given for patients in long-term care facilities. Next slide, please. These special considerations include modifications to ensure prevention of COVID transmission. Anna Carpenter will detail these accommodations further.
Thank you, Trias. So I'm Anna Carpenter, and I will be discussing health disparities and behavioral considerations within nursing homes related to COVID-19. Next slide, please. So beginning with the discussion of health disparities, I don't think it will come as a surprise that we found residents of long-term care facilities have suffered some of the most extensive impacts resulting from the COVID-19 pandemic. Approximately 40% of all COVID-19 related deaths in the United States have been linked to long-term care facilities, and COVID-19 has been described as somewhat of a perfect storm, causing catastrophic damage within nursing homes. Residents typically have multiple comorbid conditions, live in small rooms with limited distance between resident beds, and most residents do require hands-on care, and staff has to provide care to numerous residents each day. And this movement between residents increases likelihood of transmission, leading to a much greater infection and death rate within nursing homes compared to the general population. Next slide. So, talking about health disparities, the COVID-19 pandemic has only exacerbated previously existing health disparities that were rooted in structural systemic inequalities and social determinants of health. Early studies of COVID-19 cases and deaths in nursing homes have indicated that risk factors include having a higher number of beds, being located in an urban area, having fewer registered nurses on staff, and serving a higher percentage of Medicaid insured and Black residents, as nursing homes with these characteristics experience higher rates of COVID-19 cases and deaths. The included graphs shown on the slide show that nursing homes with greater percentages of racial and ethnic minorities are predicted to experience significantly higher numbers of COVID-19 cases and deaths. Considering the catastrophic impact that the pandemic has had on this population, healthcare providers and leaders within nursing homes must continue to be educated in how they can act to reduce their patients' risk for COVID-19 and related adverse health outcomes. Next slide, please. So prevention is key, and in an effort to mitigate adverse health outcomes and disparities linked with the COVID-19 pandemic, I will be discussing some behavioral considerations for long-term care facility staff, residents, and visitors. So prevention is key, and three basic behaviors that are effective in preventing COVID-19 are source control, so wearing a mask, physical distancing, and use of personal protective equipment. So full personal protective equipment includes a gown, gloves, eye protection, and an N95 or equivalent or higher level respirator. And this should be worn when caring for residents with a suspected or confirmed infection of COVID. Next slide. So vaccination is another crucial measure in preventing infection. It's one of the most important ones that we have right now. As shown in the graph to the right, vaccination in residents and staff within long-term care facilities has helped decrease the number of confirmed cases within nursing homes, but even more significantly, it's decreased the number of deaths following vaccination of residents and staff. So in August of 2021, the Centers of Medicare and Medicaid Services, or CMS, announced that it would be issuing a regulation for all nursing home staff to be vaccinated against COVID-19 as a requirement for long-term care facilities participating in Medicare and Medicaid programs. However, as you can see in the table, according to CMS, Tennessee does lag behind the national standard in vaccination rates of both staff and residents within long-term care facilities. Next slide, please. So fighting the pandemic within nursing home setting remains impossible without access to rapid, accurate testing for both staff members and patients. So anyone with symptoms of COVID-19, regardless of vaccination status, should receive a viral test as soon as possible. Also, patients in close contact with a confirmed case, those newly admitted to the facility, and residents that have been absent from the facility for greater than 24 hours should receive testing. And if and when test results come back positive and you have a confirmed case, it is critical to follow infection control protocols by identifying and maintaining a separate space within the facility to monitor and care for those residents with a confirmed and suspected infection. Next slide, please. So work restrictions have changed now. In general, healthcare providers that are up to date with all recommended COVID-19 vaccination do not require work restriction following a COVID-19 exposure. But those healthcare providers with an asymptomatic infection or mild to moderate illness who are not immunocompromised may not return to work for 10 days or 7 days following a negative test result. And to return to work, symptoms must be improving without a fever and use of fever-reducing medication for at least 24 hours. Healthcare providers that are immunocompromised or do suffer severe or critical illness will need to be absent for an extended period. Next slide. So guidelines do continue to change with dining and activities as developments are made. With the development of vaccines, activities and dining may now be provided in a communal setting, which does allow for socialization. However, obviously residents that are placed in isolation or quarantine may not participate in these communal events. Next slide. Visitation and screening. This is another thing that's also changed with the developments made throughout the pandemic. While the Centers of Medicare and Medicaid Services, or CMS, is concerned about COVID-19 cases in nursing homes, CMS is also concerned about the effects of isolation and separation of residents from their loved ones. Isolation and limited visitation can be traumatic for residents, and it results in physical and psychosocial decline. Furthermore, we now know that visitation can occur in a manner that doesn't place other residents at risk for COVID-19 by adhering to practices for infection control. Residents also have the right to receive visitors as long as it doesn't infringe on the rights of other residents. Therefore, visitation must be permitted by law as long as visitors abide by rules to protect other residents, such as wearing a mask, physically distancing around residents and healthcare workers. Next slide. Non-compliance with COVID-19 guidelines may continue to be a reoccurring issue as this pandemic develops, but please remind staff and visitors of the facility that each of these infection control practices is in place to protect residents of the facility. The Social Security Act requires any nursing home that does not achieve compliance with federal requirements within 6 months be terminated from participating in Medicare and Medicaid. Therefore, long-term care facilities really cannot afford to maintain staff members that refuse to comply with federal guidelines in place to protect our residents from COVID-19. Next slide. And now I will be turning it over to Claudia, and she's going to talk about some environmental considerations.
Thank you, Anna. Hello, everyone. My name is Claudia Drema, and I'm currently a senior here at East Tennessee State University. I'm a public health major with a concentration in healthcare administration and a minor in marketing. And I'll be going into more detail on the environmental impacts that COVID-19 has created. Next slide, please. Earlier, Trias elaborated on how COVID-19 spread and how it began the pandemic we all went through. I'll be discussing how they impacted our daily environment, specifically going into detail on work and family, and then combining the two into discussing long-term care facilities. COVID changed the world and how we went about our days completely. Before, people went about giving others hugs and handshakes, and now people are more cautious when it comes to that. It has affected everyone in many different aspects. It caused people to isolate themselves from the world and only do things virtually rather than risking the virus. The biggest change was the new guidelines put into place, such as wearing a mask when out in public, social distancing, and then also including the shutdown of most businesses. Next slide, please. The work atmosphere completely changed during COVID, which I'm sure many of you can attest to that. It went from being in person and collaborating with your coworkers to working through virtual platforms. This adjustment caused a major shift in the work dynamic and as people weren't being engaged as before due to being at home where there are many distractions. Throughout my research, I came across an article from Pew Research Center which did a further dive into how COVID impacted the way individuals would like to work. Before the pandemic, most individuals said their job could be majority done from home or via teleworking. Now on the chart, you can see that 71% of individuals are working from home, and given the opportunity, we'd prefer it to stay that way. There could be many different factors as to why individuals are choosing not to go in, but we do know for sure that COVID made an impact. There's also the issue of engagement. According to my source, younger teleworkers are more likely to say they've had a harder time feeling motivated to do their work since the outbreak started. Having an issue like this occur while also dealing with the battle of distractions at home is going to cause a major shift in what is allowed to happen in the workplace in the future. There's also the issue of people who are getting called back into office that during COVID decided to move and travel. Are they going to go back or do they fight to get a remote position? There's many different shifts that COVID has caused, and it's gotten worse specifically in the healthcare setting. It caused healthcare professionals to have a harder time trying to figure out how to treat COVID-19 patients as they're coming in. It caused a huge adjustment because nobody knew the long-term effects and how to help these individuals get back to their health prior to COVID. It also caused nursing students aspiring in the field to struggle with getting real-life experience. It was harder to find placement for them due to not wanting to increase the spread and also having to educate these new students on updated protocols. It continued causing stress on people in the field due to losing so many patients at an uncontrollable rate. This caused them to become overwhelmed and seek mental assistance through counselors. This has just created a huge adjustment in the healthcare facility. Next slide, please. Now I'm going to turn the conversation towards discussing how the home aspect has changed. Many people's lives got taken away from them during the pandemic. People were forced to go into isolation during lockdown, which took them away from their families and friends. Even worse, if their families were in hospitals or other medical facilities, you weren't even allowed to visit them. So I'm going to start this section off with discussing the change of COVID between parent to child. So throughout my research, it's interesting seeing how the parent and child were both affected differently through COVID-19. Children gained milder symptoms of COVID compared to adults, so health-wise, that was a positive. Although they did have a lot of sudden change which could affect a child immensely, such as sudden changes in routines, resources, and relationships, which this is because of the restrictions on physical interaction. This caused stress to the parents since they became the prime educator for their child's school and also their only playmate. This could be overwhelming to a parent, especially if they are still doing work virtually. They don't have the proper time to do everything that is being asked from them. So for people with families, it shifted the home dynamic, but for individuals who are alone, it caused different issues. It caused stress to mental health and caused people to gain different disorders such as depression, anxiety, and substance abuse. In a study during June 2020, it showed that 13% of individuals reported new or increased substance use due to coronavirus-related stress, and 11% of adults reported thoughts of suicide in the past 30 days. Suicide rates have long been on the rise and more than likely worsened due to the pandemic. On average, across 2017 and 2020, nearly 11 million adults reported having serious thoughts of suicide within the past year. Additionally, deaths due to drug overdose were 4 times higher in 2018 than in 1999. This is driven by the opioid crisis, but also the pandemic. Yes, the pandemic shifted the way people went about their lives and not being able to hang out with their social crowds, but people also lost their loved ones who were alone and potentially even lost themselves during this time. Next slide, please. After seeing how both home and work life were affected, we're now going to combine the two and discuss long-term care facilities. More than 200,000 long-term care facility residents and staff have died due to COVID since the start of the pandemic, and these make up 23% of all COVID-19 related deaths in the United States. The people who were in long-term care facilities dealt with a huge struggle since their visitation rights were limited and taken away for periods of time. For the people in the facility, they had to be alone with no way of in-person contact with their own families. They also had to worry about death possibly coming without any major warnings. This brings to the fact of how much grief happened on the outside world of families having loved ones in these facilities passing away. You couldn't give a final goodbye. Having this thought is something nobody ever wants to deal with. This is something that makes it so much harder to grieve because you never got that final goodbye that you were expecting. And it gets even worse because during COVID-19 and the pandemic overall, you weren't allowed to have large gatherings, so people weren't even allowed to have funerals. Next slide, please. Some ideas that would help decrease these from occurring involve changing and improving the precautions that are already put in place. Before the pandemic, you would see simple things like hand sanitizers and warnings to not come in when you're sick. Now you must take many precautions just to enter the building. You're greeted by people who take temperatures and ask COVID-19 related questions to ensure that you are not infected. You must also wear a mask and be aware of proper hand hygiene, which is washing hands frequently and being cautious of all the things that you are touching along with social distancing. Long-term care facilities were also limiting the amount of people who could visit the location to prevent an influx of people who could possibly be asymptomatic and bring the virus into the facility. Enforcing and performing these actions helps people feel safer about being in a healthcare facility during the pandemic. A way to make this even more secure would be to place hand sanitizer in every resident's room, outside each room, and other common areas to ensure that they all have the proper resources to be safe. Another recommendation would be to make sure the staff is being trained and up to date on the guidelines the CDC is putting out to stay informed. By doing so, this can prevent major outbreaks from happening. Next slide, please.
Hello, everyone. My name is Ben Brown. I'm a senior health admin major in the College of Public Health here at ETSU. And today I'm going to be talking with you about the economic impacts of COVID-19 as they pertain to nursing homes. So to get started, I would like to go over a statistic. So around 80% of deaths in the United States from COVID-19 have occurred among those 65 and older. And although Americans 85 and older only make up about 2% of the US population, they comprise nearly 30% of those who died from COVID-19. And globally, there are similarly devastating figures that describe the decimation of the oldest generation by COVID-19. So to get started, nursing homes have faced a tidal wave of problems, including acutely ill residents, huge exacerbation of staff shortages due to both illness and fear, and the loss of visiting families who provided innumerable hours of support by feeding and caring for their loved ones in these facilities. Also worth noting is that Medicare and Medicaid, the two federally funded health insurance programs, spent over $1.5 trillion on health services provided to around 140 million beneficiaries in the full year 2020. And this equates to $10,714 spent per person. However, it's also important to note that even pre-pandemic, financing for nursing home care by both Medicare and Medicaid had been declining for years. So continuing, nursing homes had actually seen decreasing occupancy rates for decades, and this is in spite of the aging US population. Another issue is that the number of patients discharged from hospitals to nursing homes for rehabilitation has also decreased. Primarily in an effort to constrain healthcare spending, these individuals are being sent directly home. This, along with the fact that nursing homes have been all but forced to turn away prospective patients after hospital stays because of fear of COVID-19 getting into their facilities, which could devastate their residents. And these two factors together have actually resulted in a serious squeeze on nursing homes revenue as these short-term stays are being essentially all but removed from common practice. And why this would matter. So to demonstrate, the national average daily cost of a private room in a nursing home is around $290 a day. So even if a patient only stays for 7 days, that equates to more than $2,030 in revenue. And that's just for the room alone. That's not taking into account the care or the supplies used in the care. So now the reason this matters is when you take into account a situation where a facility has 20 COVID positive residents at a given time with 2 resident checks per day. So masks cost around 14 cents each and gloves cost around 16 cents each. This results in $5.60 a day for masks and $6.40 a day for gloves, or around $12 a day for both. Now, when you look at it from a weekly perspective, these supplies are going to cost you $84 a week. From a monthly perspective, it's going to cost $360 a month for masks and gloves, And then finally, yearly, it's going to cost around $4,380 for both of these supplies. And this is no small figure, especially when you consider that even just a few short-term rehabilitative stays could more than recoup the losses on these supplies. Also worth noting from this graphic is that healthcare system spending on N95 style masks was up 14,302% when you compare March of 2019 to March of 2020, which is absolutely staggering. And as you can see, it wasn't just N95s, it was also the surgical masks, isolation gowns, and exam gloves that were also being bought and having more money spent on them. So continuing with decreasing census counts even before the pandemic, many nursing homes had little to no cushion to respond to the national emergency. They ended up having to divert resources in order to stop the spread of COVID-19 by purchasing personal protective equipment as well as COVID tests for residents and staff. However, many facilities lacked adequate supplies of both. And in the coming months, some nursing homes are going to struggle to pay their rent. Others may struggle to pay their staff. Some may be forced to file for bankruptcy, and still others may be forced to close their doors altogether. And this would be potentially devastating to the hundreds of thousands of nursing home residents that could potentially be displaced. But not only that, it would be devastating to their families in what is already considered a precarious time. It's worth noting that an adult caregiver who cares for an aging parent will face losses equivalent to $100,000 a year on average, which is roughly the same amount of money that you would spend for a nursing home stay of the same amount of time. And not only do you need to think about finances, you need to think about the clinicians and staff in these facilities who have also had increased job responsibilities, increased work hours, as well as increased stress overall, all of which can lead to burnout, which is costly even under normal circumstances, and these are not normal. So finally, in conclusion, the COVID-19 pandemic has decimated elderly individuals and the systems that we use to care for them. Some advocates estimate that in the coming years, it will actually take as much as $15 billion in federal funds just for nursing homes to survive the COVID-19 pandemic. And next will be Savannah talking on systems impacts.
Hello, everyone. My name is Savannah Mahaffey. I'm a senior in the College of Public Health, majoring in health administration. Today, I'll be talking about how COVID-19 affected governmental systems, health systems, and social support systems. These systems play into not only the lives of our citizens, but everyone in the community. I'll also be giving a COVID-19 perspective from Rachel Dean at the Sullivan County Regional Health Department. Next slide. The biggest COVID-19 governmental impact was actually at a local level. Only 1/3 of local governments have received any CARES Act funding. 84% of local governments projected a decrease in revenue for their first budget in the pandemic. There was a hiring freeze put in place by 52% of local governments. This was to try and arrange a new budget for the challenges for the current year. There have been few local governments to completely halt capital improvement projects due to COVID, but 45% have delayed improvements to road and sidewalk infrastructure. Nearly all, which is about 94% of local governments, shift to virtual-only meetings. About 74% adopted a staggered schedule for their employees to promote distancing and health standards. Most expect to keep this hybrid schedule even after the pandemic is ended. Next slide. And now I'll move on to how COVID-19 affected health systems. So right as COVID was hitting the world, there have been many improvement projects going on worldwide. A lot of them were being made in a lot of third world countries and developing countries. Once COVID hit, these efforts tremendously slowed down because all priorities were shifted to COVID. Okay, and a lot of the health systems are being overwhelmed, and this is affecting not only the staff, but the patients as well. This vastly restricted the services that healthcare facilities were able to provide to their surrounding community. The rush of COVID patients made it difficult for patients with acute and chronic ailments to seek medical care. Although COVID has a very low chance of making a child seriously ill, COVID has affected them in another way. For many children, school lunches were their only source of a meal. Once COVID hit and schools were closed, they lost that meal. Okay, next slide. Okay, the children will be malnourished without this daily meal. This also means their bodies are weaker and more susceptible to diseases such as polio and measles. Since COVID hit, polio has been on the rise and circulating in several countries. The pandemic caused the suspension of all polio vaccination campaigns worldwide. This is allowing the virus to spread further and faster. In addition to the polio vaccination campaigns, measles vaccination campaigns have been suspended in 23 countries. Even having these services suspended for a short amount of time will result in more susceptible people and higher instances of vaccine preventable diseases. The WHO and UNICEF issued a statement calling for routine immunization during the pandemic. Okay, and next slide. And this is a graph showing the number of cases of polio in Pakistan and Afghanistan. And you can see how there was a major spike in cases when it reaches 2020, when all these vaccination campaigns would have been stopped. Okay, next slide. Okay, cancer patients are also having a hard time. Many need a regular administration of cancer therapies. With the overwhelmed health system, it's hard for them to receive their therapy. Without the proper medication and therapy, patients' physical and mental health will be impacted. Another major issue facing healthcare is patients with HIV and AIDS and TB. Both of these require a continuous supply of medication. Because of COVID, the interruptions in the intake of medication are becoming frequent. This can not only harm the patient, but it can also cause their bodies to build up a resistance to the therapy. Okay, next slide. And now I'll move on to how COVID affected social support systems. Mental health has been a huge issue since the pandemic started. There has been an increase in depression and anxiety. Drug addiction has gotten a lot worse since the pandemic started also. Many people have relapsed or developed a substance abuse issue. This is likely happening as a result of the social isolation and mental health issues. Domestic violence has also gotten a lot worse. This is due to more time being at home in that social isolation. This is an issue all over the world. Domestic violence cases have increased drastically worldwide. Loss of livelihood is affecting a large number of Americans. The closing of businesses due to the pandemic has left many people without an income. This can put a strain on family relationships and is likely one of the big contributing factors of the domestic violence cases rising. Next slide. And this is a chart showing the spike in calls on the helpline for domestic abuse. Okay, next slide. Okay, and lastly, I'm going to give a COVID-19 perspective from Rachel Dean at the Sullivan County Regional Health Department. So whenever COVID first hit, the health department actually did close down for a little bit. And once they were reopened, many services were limited because of COVID. All their resources were being put towards COVID. Some services were able to shift to virtual and phone visits. Services such as WIC and health education classes made the transition, although home visits did not, and they actually just recently were put back in place. With all the negativity, there were a few positives. The Baby and Me tobacco-free program did very well over the phone. Attendance actually rose during COVID. This was due to transportation issues and work flexibility that was once an issue. Social media engagement also increased exponentially. The engagement has went down, but the health department has gained many new followers that receive health and resource information on a daily basis. Teamwork is what kept everything going during the pandemic. Teamwork has always been strong at the health department, but the pandemic has only made this grows stronger. Employees showed an incredible amount of resilience and dedication to their community. They worked long hours, sometimes outdoors in the heat, rain, and snow, but still showed up every day to do their jobs and do them to the best of their ability. Okay, and thank you. That's going to be the end of my part of the presentation. We can transition back to Trieste.
All right, thank you everyone for attending our webinar. I really appreciate your time. And I'm so glad that we were able to discuss the intricacies of COVID-19 in the context of long-term care facilities. All right, and now we will be opening it up to any questions that individuals may have, and we will answer as we see fit within our panelists. Thank you so much.